on this episode of A Tale of Two Hygienists.
Our hygienists are essentially, public health hygienists. They're not the ones that are making $400 a day. Generally they're not. They're making less money every day than the private practice hygienists are. We don't want to take this group and make it difficult for them to pay dues. We want to make this a really doable experience for them to be part of this organization. For years, the Alliance worked very, very closely with the Washington State Dental Hygienists Association. We actually held our meeting with their meeting. Most of our members were actually members of the association, and it was kind of a really nice collaboration. ADHA, we had a rep come one time, and then after, I'd say 20 years of us doing this, the rep told us that we couldn't do it.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists podcast, episode number 476. I'm your host, Andrew Johnson, and thank you so much for being with us today. We have another great show for you today, and this topic kind of came in response to the ADHA episodes that we posted lately. If you missed those ones, make sure you circle back and go give those ones a listen, because you can see our jumping off point. But some of the listener response to those episodes, first of all, it was phenomenal. But several of them asked to share about groups that they could support. And I know that specifically the question was being asked, like, in my state, where can I support? And unfortunately, it's too big of a country and I can't cover everything. However, this is such a group that we're highlighting in this episode that I stumbled across and I'm very impressed with. And I think that for those of you looking for, advocacy groups or, grassroots organizations or things like that to support, you just got to kind of ask around. And, I'm sorry I don't have a better answer than that, but it's not hard. I've found several of them lately, and this is one of them. So the episode is kind of going back to, I guess, the fundamentals of who we are as dental hygiene professionals, because I feel like the industry has changed so much in the past couple of decades. And in many ways, it's kind of stayed the same too. But the core mission of being a hygienist, of being that prevention specialist, kind of gets pushed to the side in a lot of ways. And we fall into this pattern of treating only those people who come into our offices. And that's not necessarily a bad thing, right? That's what kind of the job is. That's what most of us expect. But we're hearing less and less about hygienists volunteering their times in schools, teaching the children, or maybe going out to the community to work on those individuals who can't make it into the office. And in this episode, I have a conversation with Heidi about the role of a hygiene practitioner and how hygienists in most states can actually break free from that normal setting of an office and go out to the area where people need them the most. And interestingly enough, Heidi is also part of an association, the one I was alluding to earlier. It's actually an alliance. And the link for this, by the way, is going to be in the show notes. But this alliance, they meet together. They help teach people about what they do. They talk about the business side. They talk about setting up, the 501c3s and banking and all the different types of information that you need to know to be able to be semi-successful. She did mention that this is not a lucrative job to go out into the communities like this, but there is some money in it a little bit. Anyways, it was a really great chat. You're going to love this episode. I loved having her on. If you're interested in seeing what that alliance has to offer, just head over to rdhalliance.org and you can look through their website. Thanks for listening and enjoy this interview.
A tale of two hygienists.
Listeners, welcome into the interview portion of this podcast. Joined today by Heidi. Heidi, thank you for being here.
Hi, Andrew. Thanks so much. I really appreciate you having me.
Have you been on a podcast before? Or was this your first one?
No, this is my first podcast.
Oh my goodness. Well, welcome to the podcasting space. You're going to get addicted real quick. It's a lot of fun. The reason why I love them though is because it's just hygienists talking, right? It's just like two buddies talking like we would at conferences or anything like that. So hopefully you'll just be at ease and it'll be fun. So
Right, right.
I want to clue the listeners in a little bit how this particular conversation started because, and this is the beautiful thing about, I think, a hygienist in general. I had made a post on LinkedIn. You didn't quite agree with it. And then guess what? We talked about it. And even if we're still not on the same page, like we still can have discourse and discussion about things that maybe we don't agree with. I love that about our profession.
So do I.
So, we did take it off the public side and we started talking kind of behind the scenes. And then as we were talking, I learned a little bit more about what you do. And so I was hoping that we could start this episode and just give the listeners just a little bit of your dental background and then kind of how things have evolved through the years and what where your passion lies now.
Oh, great. Yeah, sure. Let me do that. Okay, well, this year actually marks my 30th year as a dental hygienist.
Yay.
And it's been a great ride. It has. So I got bored here, I guess a number of years back, and I actually went and got a master's. And so I evolved into actually even doing some teaching for a while. So
Nice.
I've done private practice, alternative practice, taught, and currently I dabble in alternative practice. And I also, for the most part right now, I'm in private practice. And I also serve on 2 boards of directors right now after 7 years as the secretary for the Alliance of Dental Hygiene Practitioners. I am now this year their president. And that's kind of why we're here today,
That
is
is
to
why we're here.
talk about them.
Yeah. So, and that's going to be the bulk of this conversation. But before we get into that, like there's some things that just like, I'm curious, so you dabbled in education and teaching and things like that. Do you currently work with any, or are you noticing some like the younger generations that are coming out of schools now? And do you feel like there's a difference in education or requirements, or do you kind of feel like things in your 30 years, like things are just as good as they've always been?
Oh, well, I feel like that's such a great question. The requirements, I would say, are the same. In fact, in Washington State, since you're a Washi, you hail from
Oh,
Washington.
boy, yes,
One of the
Washington.
things that I love is some of the work we did was work on kind of moving the hygienists here towards their goal of conferring a baccalaureate degree for our hygienists. So 9 of our dental hygiene programs here actually confer a baccalaureate degree. So we've got a lot of hygienists here that get honored for all of their credits because hygienists put so many credit hours into their
Mhm.
education and they just get shorted that degree they really earn. So hygienists in Washington, most of them actually now are awarded that bachelor's degree. So yeah, I mean, it is in dentistry. We do, for the most part, have to have CODA accreditation for our dental degrees. And if you're a licensed professional, and CODA determines what that education and licensure and the competencies are,
Mhm.
and that
Mhm.
hasn't changed.
Yeah. Well, and I've spoken about this a lot in the podcast. I feel like Washington State, I know everyone's tired of me talking about how great Washington is for our educational, our process. And I know there's lots of other great states. There's lots of other individual schools that are awesome amongst these states. I'm not trying to say that Washington State's so much better, but that's just my experience is like we really, there's the baseline of what CODA says. CODA says you have to have these minimal requirements right here. This is your floor. But I feel like
Right.
our educational institutions have always tried to go above and beyond. You only need 20 hours for this. We're going to give you 25 hours of this. You have this requirement. We're also going to make you do this other requirement that will make you better at this first requirement. I feel like we've done such a good job in our educational programs in Washington State. I mean, applauding to everybody because it's so amazing. But I find though the frustration, I guess, is that that's not shared everywhere. I've done a fair amount of traveling across these United States, and united sometimes we are not. And it's sad to see that it does end up being just the bare minimum of what CODA requires, and that's frustrating.
You know, that is, oh my gosh, you are reading my mind today because we must have been looking at the same thing. I don't know, but you know, my whole career, I've just looked at, I think usually nursing, my sons are both nurses, and we come from a family of healthcare providers. And it's just so great to see that they have reciprocity state to state, and a nurse can just move anywhere and just glide right into their profession. And it's been so frustrating to see hygienists not have that, and the frustration when hygienists move across state lines, and the injustice they have to go through when they move to another state, and the process they have to go through, and sometimes a whole entire another board process. And even though they have so much experience, and so now with the ability with the compact and everything to calibrate that process, like something is really lost in that as well. So, and I know it's kind of like you have to kind of like, bite your finger because you want it. You want it for people to have that portability,
Mhm.
and for the profession to have the portability, and um and for both professions, for dentistry as well. On the other hand, for states that have worked so hard and expanded their scope, and gosh, you know, it almost means you almost take a scope away when you calibrate like this. It's very hard on that level to watch it as well. So I guess I feel both ways. I
Yeah.
have to say I have both feelings.
Well, and that's the thing, I sat on our hygiene examining committee for several years there in Washington State, and we would be approached by different groups of people that says, "Hey, we want to, we want our exam, or we want, maybe Canadian hygienists to be able to have some sort of reciprocity and things like that." And, we really try our very best because we do feel for the individuals, especially military families and all of them. That's because Washington has
Well,
a huge population of military families. And we want those things for them. But then at the same time, I would go to, every October, we had kind of a joint meeting with the Hygiene Association. And I would see these leaders who, again, 30 years in the profession, who were the ones, the pioneers that had been, building our scope and, all the hard work that they did. And I just look at them, I'm like, I can't do this to you. I can't take things down that you had already built into it. And I feel really bad about that. But at the same time, because Washington State is kind of a all for one, one for all license, like you have restorative function, you have all these things, your local anesthesiast, all that's just in your dental hygiene license. It's not, parsed
mhm.
out. I get nervous about disbanding that and saying, okay, well, you have your, basic traditional hygiene license, and then you have all these, like Oregon does, like where you have all these additional certifications and things like that. So I don't think we're going to find the answer today on this episode, but that is such a hard thing, and I feel for everybody.
Yeah.
And that creates inaction, unfortunately, on everyone's part because no one knows what is right to do. It's a tough one.
Yeah,
Tough
you're
one.
right. It does. It does create inaction. That's a really good way to put it. Because, yeah, I mean, because of how we've done it, to make it any other way is to actually take away our scope. It really is, because it is. It takes away our scope, because then it says that, well, sure, you can go ahead and get your licensure in Washington, but to get your licensure in Washington, you have to work really, really hard.
Yeah. Yeah. I mean, basically, that's what it's saying.
Mhm.
Yeah. Yeah. Oh my gosh. Yeah. Yeah, it's well, we need to move on to other things, but man, I
Well,
just have
it's an
so much
interesting
more.
conversation.
It is a fascinating conversation, and people that are outside of Washington, and this is kind of an interesting, like, just generally where miscommunication always happens in dentistry. I find the people in Florida are vastly different, as far as like the way the dentist treats their team members, and this is I've been in probably over 100 offices down here now. There is a very similar vibe of, more kind of authoritative top down. I'm the doctor. You do this. Teammates do this. You do what I tell you to do. Where in Oregon and Washington, it was a lot more collaborative. It was a different approach to team care. And so whatever your experience is here in Florida, when you're saying, hey, I don't feel comfortable being the champion for my patient because my doctor's just going to knock me down or, just dictate to me what's going to happen. And then you move to a place like Washington where it's expected that you're going to run that operatory
Right.
and collaborate and co-diagnose with your doctors and feed them the information that's going to help them be successful as well. It's a completely different type of hygienist, and people are saying no, it's not, but it's like, but really it is. And if you haven't experienced it, you can't talk on it, and so that's the hard part too.
Yeah.
So,
Gosh.
man. Anyways, okay, let's move on because I want to talk about something a little more positive and a little bit more happy. I want to talk about the Alliance of Dental Hygiene Practitioners. So tell me, first of all, what is the mission? What are you all trying to do? How long has it been around? Kind of who takes part in it?
Okay. Okay. So, yeah, this morning I was trying to think how long they've been around. And I think, well, at least 25 years. This is not a new organization. So let's just say 25 years because I know it's at least been that long. So, two women, it wasn't me, two women, Doreen Naughton and Anita Rodriguez. Do you know either of them?
I don't. Huh.
Oh, okay. Okay. Wonderful women. I mean, like mountain moving women. Seriously. I mean, Doreen Naughton. Well, I'm pretty sure Anita was one of the original curriculum writers on Smiles for Life,
Okay. Okay.
right? And Doreen has helped write an anesthetic book. I mean, they're just amazing women. She forever was a routine speaker at University of Washington, had a huge practice, a huge alternative practice. Both of them, amazing women. And anyway, they knew very, very, very early on that they wanted their own practices in alternative practice because in Washington State, we hygienists have their own practice act. And I decided for the sake of this recording that I should probably quick do a double check. I mean, I knew that there were at least 40 states that had alternative practice. But of course, it's just a litany of what that means to every state. And everybody it's a little bit different. I would say the vast majority of them, it's something kind of mostly under general supervision, general supervision of a dentist. And for the most part, it's public health hygienists that are out doing public health hygiene services under the general supervision of a dentist. So whether that's under school sealants or elder care settings, that kind of thing. For the most part, it looked to me like most of it, and please don't anyone get upset with me because I am definitely generalizing here, but most of it is under general supervision. And Washington State is one of the unique states in that our Dental Hygiene Practice Act, which is WAC 1829056,
Good. Good for you.
is yes, just in case somebody wants to check it out, please do. It's unsupervised practice. And so as a result, it is very limited in its scope, but it is practice. It's defined by its settings. And so its setting is in healthcare facilities. It's defined by healthcare facilities, but there's a ton of what those healthcare facilities are defined by. So, I mean, it's pretty much anything you can even imagine in terms of any elder care facilities, school sealed programs, persons with disability, and institutions, state institutions. So federal, state, local, public health institutions, correctional facilities, hospitals. We're allowed to operate in hospitals or also like medical centers that are affiliated with hospitals. So, I mean, there's just a lot of reach. And so we've actually got quite a few hygienists that have their own practices. And in Washington State, this is not a state operated program. So a lot of public health hygienists actually are structured by state. Let's say the state structures the program, and then it's maybe a Medicaid run program where they're Medicaid paying dollars that
Sure.
manage that. In Washington State, it isn't like that. These are private business owners that set up their own programs. And now I can say that said, many, many, many of our providers are Medicaid. The vast majority of what they bill is Medicaid. And that's because in our state, Medicaid's come a long way, and their compensation has really improved. Who knows what's going to happen there? But at this point, it came around to the point where that's a good payment system for our providers, but it doesn't have to be that way. They can just have private pay in these settings as well. So anyway, that is basically what that Practice Act how that Practice Act reads. And so this is an alliance, just so you understand kind of what they're doing. This is an alliance of providers that all kind of got together and decided they wanted to network together because they're such a unique group. They wanted to start networking together. And then it became very apparent after a fairly short period of time that their continuing education needs were very unique as compared to your average private practice hygienist.
For sure.
So we have our own continuing education at least once a year, and it's definitely more geared towards what children or elder care kind of issues. And we even have administrative things like, what kind of attorney are you using? What kind of accounting do you need? What kind of software programs those kind of things as well that are structured for businesses. And sometimes we'll have something that just helps boost the providers because, people need to pick me up too. So we have retreats, and so we offer so much. There's so much that we offer, but also, our website offers the ability for people to go to the website and to find a provider too. So
this is very fascinating to me. And I think, people listening to this first of all, what's the website so they can go check it out?
rdhalliance.org.
Okay. So rdhalliance.org. And so listeners, you can go there and kind of poke through all the little pages and see what's going on. I have a couple of questions. So let's just say that I work in a general practice. Can I be a part of the alliance?
Yes. So here's the amazing thing is every single hygienist in Washington State, including you, that is your Practice Act. So it's not defined. It's defined by the location. So every hygienist, if you're a hygienist in Washington State, you automatically can practice in this setting. So any hygienist that wants to join, that's the only caveat. You have to be a licensed dental hygienist to join. And you don't even have to be a dental hygienist in Washington State to join. You have to be a hygienist. So we do have a type of membership for people who are not hygienists, but they can't have access to certain parts of the website, and they also can't vote. So you have to be a hygienist to vote and to have access to certain services.
I'm going to circle back to this voting thing in just a minute, just so I can understand maybe the structure of it. Maybe one more point of clarification. So what's the breadth of the scope of services that are provided? Let's say we're at a hospital setting. What are the things that we can and cannot do?
Okay. So like I said, the services are very limited. So the services are basically prophy, scaling and root planing, topical. You can apply topical. That's it as far as, any anesthetic.
Pain management.
And fluoride, which includes SDF. So fluoride varnish SDF. And
probably sealants are probably on that, right?
Well, really, sealants fall into a little different part of that Practice Act. It's Part 220. And so school sealant programs are actually defined separately. And there's a whole entire part of the Practice Act that actually this state has the state, you go to the state and the state actually will give you the state actually has to provide materials for how to set up a school sealant program. And so it's kind of it's not defined in 056 how school sealant, what they can use. It's defined under 220 how school sealant programs are run. But school sealant programs basically only a hygienist can run one with another hygienist that they want. They can't actually supervise an assistant. An assistant can work in school sealant programs, but they would have to run one with a dentist.
Okay.
They'd have to be supervised by a dentist. Yeah.
That's really fascinating. There's that delineation. Do you envision a scenario where a medical doctor could be a supervisor of, like, again, let's say I just want to do a I don't know, injectable anesthesia, in a hospital setting. Would there ever be a scenario where a medical doctor could be like, okay, I sign off on it?
Would there be a scenario? Well,
Or is there a benefit
uh,
even to it? Maybe there's not a benefit to it. Maybe it's not worth pursuing,
well,
but that's just a
there would
thing.
be a benefit to it. However, I don't think you would see it happen because, during COVID, when it came time for COVID vaccination, that kind of came up in Washington because they needed providers who gave injections to do vaccinations, and they had a shortage of providers to provide vaccinations. And so, they were asking dentists if they would vaccinate, and so, nurses were essentially doing the vaccinations and physicians and everything. So they wanted to they kind of research whether a physician could supervise a hygienist, so the hygienist could, right?
Yeah.
So, and they're basically, we are supervised by dentists. It's very, very clear that we're supervised by dentists, and that would be a big legislative change. So I don't think that would be an easy fix.
Man,
No.
well, that might be something that, I have a whole thing of like what we should be, lobbying for in our whole advocacy, but that would be a great one. I think that people would really
It would
appreciate.
be. It would be. Yeah, because it's very, very logical, especially when hygienists can work in a hospital setting to enable that, to
Mhm.
have that possible. Yeah.
Yeah.
It's,
Um,
it's yeah.
all right, let's circle back to the voting thing. So tell me more about like maybe like the structure of this. And listeners, I'm sorry if this is not the exciting part for you. This is the exciting part for me to understand like the corporate governance of the alliance. So you said like anyone that is a hygienist in Washington State and is a dues paying member has a vote. What are we voting on?
Okay. Well, first of all, it's a whole entire $45 to be a member of the
Holy
alliance.
moly, a
Yeah,
whole
we're
hour's
really
worth of
excited.
pay. Not even in
So
Seattle. It's like half hours of pay in Seattle. Dang.
no. We so our hygienists are essentially, public health hygienists, and so they're not the ones that are making $400 a day. Generally they're not. They're making less money every day than the private practice hygienists are. So this group, I'm going to make a plug for them. This group, this is a calling for them. It truly is. I mean, most of them are in a pretzel during the day. Their ergonomics are not ideal. I mean, they're climbing into bed with these clients to clean their teeth, or like they're not in ergonomically proper technique to clean their teeth. These people can't comply perfectly. You can imagine. And so these are people, they have a passion to do this work. And that's really important because this is such an access issue to deal with this population. And this is a population that has very complex medical issues, and they have a lot of comorbidities and complex medical histories and lists of medications they take. So for these people to see these patients, it's pretty fascinating. So we don't want to take this group and make it difficult for them to pay dues. We want to make this a really doable experience for them to be part of this
See what
organization.
you do with that.
So back
Doable,
to
the
your
do's.
question, I
Good.
didn't mean to not answer it, but I really want you to understand this group. So what we're voting on is once a year, we have an annual membership meeting. And that annual membership meeting basically is where any business that got conducted that year, usually that's coupled with a conference, and then any business that got conducted that year. So usually that's, any policies, interim policies we passed, they have to get voted on. Any elections, any nominations and elections of officers, things like that have to, that business has to get passed. The, treasurer's report, the officer report, all the really fascinating stuff that goes on in organizations, they have to validate that we filed our Secretary of State report, that kind of thing, that businesses do to actually honor that your organization is doing its due diligence. So once a year, we have a quick business meeting either before or after our meeting with our group, and only members actually can weigh in on that.
Let me ask this, as we're kind of coming down the hill in this last couple of minutes here. What I found very fascinating, the last probably, trying to do the math in my head, I would say 4 weeks, maybe 6 weeks by the time this airs, is that there are alliances, there are coalitions, there are groups, there are not necessarily new associations, but kind of newer like groups that I'm just now finding about. Does the alliance work with any other groups, or do you know of any other groups that are out there that are maybe small grassroots, really trying to make a difference?
Well, so for years, the Alliance worked very, very closely with the Washington State Dental Hygienists Association. We actually held our meeting with their meeting, and they just let us use one of their rooms. And then it kind of made it convenient. So our members would take classes, say, one day a week with most of our members were actually members of the association and would take classes, say one day a week over there. And then one day a week, we would host ours, and then they'd take classes with ours, and then they could get, say, their CPR, BLS handled too.
Sure.
And it was kind of a really nice collaboration. And then ADHA had a rep come one time, and then after, I'd say 20 years of us doing this, the rep told us that we couldn't do it, that ADHA can't have any other organization at a hygiene association meeting. So after all these years of doing that, we had to suddenly figure out how to host our own meeting. And that was kind of like a financial and logistic kind of challenge for us. And so, yeah, right. And so we've been doing that for maybe it's been 5 or 6 years now, but it has allowed us to actually work more with other organizations. So we're working a lot more with elder care organizations and developing some of those relationships in kind of the gerontology world, and maybe some of the things that are in our wheelhouse that we should be doing too anyway. I don't know. We're, as an organization, we're very neutral. We're very pro-hygiene supportive.
Of course.
And try to be supportive of any organization around us that supports the patients. So, it seems like there's so many organizations that support hygienists and support patients. You hardly have time to meet them all and work with them all. I mean, if you really reach out and realize how many are out there, you're right, there's so many. So, and this new one is great. A lot of our members have joined this new one too, the Dental Hygiene Advocates of Washington. So that's another really exciting one.
I'm really excited to get them on the show. I think after kind of the legislative session, when they can breathe a little bit, since I've been working so hard, I'm going to get them on the show and just kind of talk about kind of how they got organized and and kind of like the fundamentals of like filing for 501c3 and all that kind of stuff, like what that looks like, maybe trying to help others that might be listening to the show, create maybe not exactly the same, but if they need some sort of advocacy group that they wanted to start. I just released an episode this morning that Kathy Cabenzone here in Florida started a new group, and what she's doing is phenomenal. It's absolutely amazing. My heart is so happy that there are all these groups out here, but I think that when you go down the rabbit hole of the social media forums, people are like, we have no group, we have no leadership, we have no association, we have no whatever. It's not ADHA, there's nothing. I'm like, that's not true, guys. There's so many things, including ADHA for lots of people that are there working for hygienists. And so I'm glad that you mentioned that because that's so great. Heidi, I would love to talk to you a little bit more. We're unfortunately short on time. Is there any last messaging about the Alliance that you want to talk about or something that you wish I would have asked you?
Well, the only thing I'd like to say is I think that it's really awesome that we have so much alternative practice in our states. And I want hygienists to really consider trying it out. A lot of our hygienists don't do this full time. A lot of them dabble in it. And it's a wonderful thing to do if you like flexibility. It's a great thing for moms to do if they're trying to work around kids' schedules, because you can schedule your own hours. You see patients whenever you want to see patients, when it works for you. And, there's a lot of opportunity with it. So in all kinds of states. And we'd really like to expand our group to other states. We do have some hygienists in Oregon that have joined our group, and one in Montana and one in California. So, we kind of would like to see our group expand into other states. But, there's so much more opportunity with SDF now and teledentistry that, it's only growing. So I want hygienists to really consider how this is a really good opportunity for them.
I want them to consider it
It's a
too.
great calling. Yeah.
That's great. And it was rdhalliance.org, correct?
Yes.
Awesome.
Yes.
Listeners, head over there if you're interested in more. Check out the website. Kind of again, like I said, poke through all the tabs, and if you have any more questions, you guys must have a contact page on there as well. Do you feel comfortable giving your email address out as well?
Contact me does come right to me.
Oh, fantastic.
The contact email comes right to me.
Awesome. Heidi, thank you so much for your time this evening.
Thank you so much. I really appreciate it. It was great talking to you.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.